In recent discussions surrounding the state of American science, a striking contrast has emerged between the rhetoric of certain political figures and the empirical realities presented by researchers. Notably, Stephen Miller, a former advisor to Donald Trump, has been a vocal critic of immigration's impact on the scientific community. However, emerging research challenges his assertions and underscores the vital role that immigrants play in advancing American science and technology. A report highlighted in Forbes reveals that immigrants are not just contributors but rather they are instrumental in driving innovation within the United States. According to a comprehensive analysis by the National Science Foundation, nearly 1 in 4 scientists and engineers in the country are foreign-born. This demographic not only enhances the diversity of thought and perspective within research institutions but also propels advancements in fields ranging from medicine to artificial intelligence. Dr. Alice Chen, a prominent researcher involved in the study, emphasized the importance of this talent pool, stating immigrants bring unique skills and experiences that enrich our scientific endeavors. Their contributions are pivotal in addressing some of the most pressing challenges we face today. The data corroborates her assertion. A significant percentage of patents filed in the U.S. have at least one immigrant inventor, showcasing their critical role in fostering innovation. Despite these findings, Miller's narrative persists, suggesting that immigration undermines the integrity of scientific research. This perspective has been met with skepticism from the academic community, which argues that the exclusion of international talent could stifle breakthroughs essential for maintaining the U.S. competitive edge in technology and research. In fact, a report from the National Academy of Sciences indicates that the U.S. risks falling behind other nations if it continues to impose restrictive immigration policies. Moreover, the recent push by former President Trump for what he termed gold standard science has raised alarms among researchers. Many fear that such an agenda could politicize scientific inquiry, prioritizing certain types of research over others based on ideological grounds. This shift could not only hinder the objectivity that research requires but also alienate a significant number of scientists who may feel their contributions are undervalued or dismissed. As discussions about immigration and its implications on science continue, the consensus among researchers is clear: a collaborative, inclusive approach that embraces diverse perspectives is crucial for the future of American innovation. The scientific community stands at a crossroads, grappling with the need to advocate for policies that support global collaboration while countering narratives that undermine the contributions of immigrant scientists. Looking ahead, the landscape of American science will likely evolve as these debates unfold. The resilience and adaptability of the scientific community will be tested, but the ongoing dialogue about the importance of diversity and inclusion in research may ultimately lead to policies that better reflect the realities of today's interconnected world. As researchers continue to advocate for their international colleagues, the hope is that the narrative will shift towards recognizing the indispensable role that all contributors play in shaping the future of science and technology in the United States. In a move that has sparked significant debate within the public health community, Robert F. Kennedy Jr., the controversial Secretary of Health and Human Services (HHS), recently canceled a substantial $766 million government contract with Moderna aimed at developing a bird flu vaccine. This decision, made public on June 1, 2025, has been met with alarm from health experts who warn that it may undermine future pandemic preparedness and vaccine innovation. The contract in question was awarded to Moderna, the biotech company known for its pioneering work in mRNA vaccine technology, which was instrumental in the rapid development of COVID-19 vaccines. The H5N1 bird flu strain has been making headlines recently due to its outbreaks among poultry in the U.S., raising fears of a potential mutation that could enable it to infect humans. Historical instances of bird flu outbreaks have resulted in mortality rates as high as 50% in humans, a stark contrast to the significantly lower rates seen during the COVID-19 pandemic. The potential for a catastrophic outbreak prompted the Biden administration to initiate funding for a vaccine development program that could leverage Moderna's technology. Kennedy's abrupt cancellation of the contract has raised eyebrows. particularly given his long-standing skepticism about vaccines. A spokesperson for HHS attributed the decision to concerns about safety, integrity, and trust, describing mRNA technology as undertested. This assertion has been met with strong rebuttals from public health experts. Dr. Ashish Jha, dean of the Brown University School of Public Health, countered that the mRNA vaccines have been administered to approximately 1 billion individuals with rare reports of serious side effects, thereby establishing a robust safety record. Dr. Adam Loring, a chief of infectious diseases at the University of Michigan, echoed this sentiment, stating that mRNA vaccines have undergone more scrutiny than almost any vaccines in history. He described the decision to halt the development of a vaccine for bird flu as a potentially catastrophic error. The implications of this cancellation extend beyond immediate vaccine availability. It signals a broader trend of uncertainty in U.S. health policy and vaccine development. In a separate but equally contentious move, Kennedy announced a significant change in the guidelines regarding COVID-19 booster shots. In a brief social media video, he stated that the Centers for Disease Control and Prevention (CDC) would no longer recommend boosters for healthy children and non-elderly adults, including pregnant women. This decision diverged sharply from the previously established medical consensus, which advocated for booster shots to protect vulnerable populations, particularly pregnant women, who face increased risks from COVID-19. The manner in which the announcement was made has drawn criticism for lacking the usual transparency. Typically, CDC recommendations are based on rigorous data analysis and reviewed by advisory committees composed of outside experts. However, this time the advisory committee had not convened, raising questions about the legitimacy of the decision-making process. Experts have voiced concerns that the new guidelines might confuse healthcare providers and insurers, potentially limiting access to vaccinations for those who need them the most. As public health officials grapple with the fallout from Kennedy's decisions, the overarching concern remains the potential impact on future vaccine development and public trust in health recommendations. With the specter of new pathogens looming, experts warn that the U.S. may find itself unprepared for the next health crisis if support for vaccine innovation continues to wane. In a landscape where the demand for rapid vaccine development is paramount, the implications of these recent changes could echo for years to come, affecting not just the fight against bird flu but also broader public health initiatives worldwide. As the situation evolves, stakeholders in the healthcare sector will be watching closely to see how these policies affect vaccine research and public health response in the future. In a significant advancement in cancer treatment, Gilead Sciences has reported promising results from its experimental CAR T-cell therapy aimed at treating one of the most aggressive forms of brain cancer, glioblastoma. This development, announced on June 1, 2025, has the potential to reshape therapeutic approaches for patients battling this formidable disease, which has long posed a challenge for medical researchers and clinicians alike. The clinical trial data released by Gilead indicate that the CAR-T therapy, designed to harness the power of the patient's own immune cells, has led to measurable improvements in survival rates compared to standard treatments. The trial focused on patients with recurrent glioblastoma, a condition notorious for its poor prognosis and limited treatment options. According to Gilead, the therapy demonstrated a notable ability to target and eliminate cancer cells effectively while minimizing damage to surrounding healthy tissue. These results not only provide hope for patients diagnosed with glioblastoma but also underscore the transformative potential of CAR-T therapies in solid tumors, said Dr. Emily Tran, the lead investigator of the study. The therapy utilizes genetically engineered T cells that are programmed to recognize and attack specific tumor antigens, thereby enhancing the body's natural immune response against the cancer. The implications of this breakthrough extend beyond just survival rates. As glioblastoma is characterized by its rapidly evolving nature and high resistance to conventional treatments like chemotherapy and radiation, the advent of CAR-T cell therapy could signify a paradigm shift in how oncologists approach treatment strategies. Experts believe that this could lead to more personalized medicine, where therapies are tailored to the unique genetic makeup of individual tumors. In a related development, new research has emerged regarding the prediction of immunotherapy responses in lung cancer patients. A study published on the same day reveals that mapping tumor microenvironments can significantly enhance the ability to forecast which patients may respond favorably to immunotherapy. This research highlights the complexity of cancer biology and the necessity for advanced diagnostic tools to optimize treatment protocols. Concurrently, a trial in breast cancer treatment has yielded groundbreaking results. The SERENA-6 trial demonstrated that the drug camizestrant could effectively halt the growth of hormone-sensitive breast cancer tumors, reducing the likelihood of disease progression by 52% compared to standard therapies. This trial, which included over 3,000 participants across 23 countries, represents a critical step forward in precision medicine. This breakthrough illustrates how we can leverage molecular insights to make informed treatment decisions, remarked Professor Nick Turner, a co-principal investigator of the study. These advancements come amid a backdrop of ongoing concerns regarding funding cuts to scientific research in the United States. The proposed budget from the Trump administration threatens to significantly reduce financial support for agencies like the National Institutes of Health (NIH) and the National Science Foundation (NSF). Experts warn that these cuts could stifle innovation in cancer research and other critical scientific fields, potentially undermining the progress made in recent years. As the medical community digests these recent developments, the focus will undoubtedly shift toward the long-term impacts of these therapies on patient outcomes and the sustainability of research funding. The juxtaposition of groundbreaking clinical trials and potentially detrimental political decisions creates a complex landscape for the future of cancer treatment and research. The hope is that with continued innovation and support, the fight against cancer will be met with increasingly effective strategies that save lives and improve quality of life for patients worldwide. The landscape of artificial intelligence (AI) continues to evolve rapidly, with the National Science Foundation (NSF) playing a pivotal role in driving innovation and research across the United States. Recently, at the AI Plus Expo held in Washington, D.C., the NSF showcased its commitment to advancing AI technologies through various initiatives and programs aimed at fostering collaboration, education, and economic growth. This year's event, running from June 2nd to June 4th, highlighted the NSF's strategies to enhance AI research and its practical applications, underscoring the agency's significant annual investment of approximately $700 million in AI-related initiatives. One of the key features of the NSF's efforts is the National Artificial Intelligence Research Institutes program, which was launched in 2019 and currently encompasses 27 institutes spread across the country. These institutes bring together over 500 funded and collaborative institutions focusing on diverse aspects of AI research, including advanced cybersecurity, human AI collaboration, and AI applications in agriculture and food systems. The NSF's booth at the Expo not only displayed groundbreaking technologies but also provided insights into how these institutes facilitate the translation of research into tangible impacts in society. In addition to the institutes, the NSF's America's Seed Fund exemplifies its dedication to nurturing innovation within the startup ecosystem. This initiative supports around 400 startups each year, providing them with critical funding of up to $2 million to transform scientific discoveries into commercially viable products and services. The program is crucial for de-risking technology, particularly in the realm of AI systems and hardware, and has been instrumental since its inception in 1977. Furthermore, the NSF Regional Innovation Engines program aims to create robust regional innovation ecosystems across the United States. By catalyzing partnerships among industry, academia, and government, the program seeks to address pressing national challenges while stimulating economic growth and job creation. Each NSF engine can receive up to $160 million to support collaborative research and development efforts, showcasing the NSF's proactive approach to fostering innovation in less economically developed regions. As the NSF continues to champion AI advancements, other developments in the tech world are also shaping the future of AI and related technologies. Rose Yu, an associate professor at the University of California, San Diego, has emerged as a prominent figure in the field of physics-guided deep learning. Her work integrates principles of fluid dynamics into AI systems, enhancing their capabilities in predicting traffic patterns, improving climate models, and stabilizing drone flight. Yu's innovative approach has the potential to not only advance AI technology but also revolutionize how scientific research is conducted, with her vision of an AI scientist poised to assist human researchers in generating new insights. On the corporate front, NVIDIA and Dell have partnered with the U.S. government to develop a next-generation supercomputer. Further illustrating the increasing reliance on powerful computing resources for advancing AI technologies. This collaboration aligns with the global trend of investing in high-performance computing to tackle complex challenges across various sectors. Meanwhile, not all AI initiatives are progressing smoothly. In South Korea, a government project to establish a national AI computing center has faced significant hurdles, with the initial bidding process concluding without any applicants. Concerns regarding the project's profitability have led to a lack of interest from potential operators, prompting the government to reopen the bidding process. This situation highlights the challenges that can arise in the public-private partnership model, particularly when financial viability and operational autonomy are in question. As the AI landscape continues to mature, the interplay between governmental support, academic research, and private sector innovation will be crucial in determining the trajectory of technological advancements. The NSF's initiatives at the AI Plus Expo present a forward-looking vision, but the setbacks experienced in projects like South Korea's National AI Computing Center serve as a reminder of the complexities that accompany large-scale technological endeavors. Looking ahead, it will be essential for stakeholders across all sectors to collaborate effectively and navigate the challenges that arise, ensuring that the promise of AI is realized in a manner that benefits society as a whole. Engineers at the U.S. Department of Energy's Princeton Plasma Physics Laboratory (PPPL) are leveraging an innovative approach to expedite the construction of a key component in their ambitious nuclear fusion project, the National Spherical Torus Experiment Upgrade (NSTXU). By utilizing detailed 3D printed models of complex magnet systems, the team is not only reducing risks but also accelerating the overall timeline of the project, which is considered vital for the future of fusion energy. At the center of this initiative is a massive magnet bundle currently being constructed in Spain. This bundle, which includes a 19-foot toroidal field TF magnet and an accompanying ohmic heating OH coil, aims to produce the highest magnetic field of any large spherical torus. The successful operation of this component is crucial for assessing whether compact spherical tokamaks could provide a more efficient pathway to a fusion pilot plant. Anticipating the arrival of the actual magnet in the fall of 2025, the PPPL engineers have created a 40-inch tall, 2-foot wide red plastic 3D printed model that accurately replicates the top of the magnet bundle. Senior project manager Tom Jernigan likened the prototype's appearance to a Hollywood set, remarking, "If it were a Hollywood set and you painted the TFOH 3D print a different color, it would look just like the machine. It's the best money we ever spent." This dress rehearsal strategy is pivotal to the NSTXU project, as it allows for meticulous pre-fitting of components before the actual assembly begins. Project Director Dave Micheletti emphasized the significance of this approach, stating the use of 3D printed prototypes has been instrumental toward reducing risk and accelerating the schedule. It allows us to positively confirm that components will fit together and eliminates the risk of rework once final assembly starts. It's saving both time and money. The current model is essential for prefitting 36 cooling water lines that will manage the overheating of the powerful magnets during experiments, which can reach plasma temperatures exceeding those of the Sun. Additionally, a similar 3D model is planned for the bundle's bottom section, contributing to the thoroughness of the preparation process. The precision of this prefitting extends to the 2,000 plasma-facing tiles designed to protect the machine's interior, ensuring their placements are within tolerances of just a few thousandths of an inch. Micheletti noted, after a huge effort by the team, everything is coming together very well, indicating a robust collaboration among engineers. Meanwhile, at Elite Energy in Spain, the actual TF magnet is in the process of construction. Technicians there are also employing prototypes to refine each construction step before assembling the real magnet, which involves piecing together 4 quadrants that resemble slices of a pie. This meticulous approach has already cleared what senior PPPL engineer Danny Kai referred to as a major hurdle in the construction process. Once completed, the TFOH bundle will be integrated into the NSTXU at PPPL, marking a significant milestone in the journey towards achieving sustainable nuclear fusion. The application of 3D printing technology in this context not only showcases its transformative potential in large-scale engineering projects but also highlights a forward-thinking methodology that promises to enhance the efficiency and safety of future fusion energy developments. As the NSTXU project progresses, it stands as a beacon of hope for the global pursuit of clean and sustainable energy solutions through nuclear fusion.